Hello, my name is Jen. Welcome to my channel. What I'm going to talk about on this channel is basically my gastric bypass journey. Though it hasn't been an easy one, I do have a surgery date scheduled for February 24th of 2020. So I am very excited and getting a little nervous, but I just wanted to start this channel in case anybody else was like me who really wanted to research it before they went and did it. So this is the start to my journey. I'm getting a second chance at life on February 24th, and I couldn't be happier. Just a little bit about the process. For me, it hasn't been an easy one. First of all, I was supposed to have gastric bypass 2 years ago. And unfortunately, my insurance had changed the month before. No, I'm sorry. I'm wrong. I do apologize. It was the month of my surgery. My insurance changed and gastric bypass surgery was no longer a covered benefit. So I had authorization with my previous insurance, and they wouldn't honor that, unfortunately. So I had went through the entire process, the dietitian meeting, the bariatric class, and the consultation with the surgeon. I picked a surgery date. I had my upper GI. I had everything done. The sleep apnea study, which I am on a CPAP, and I have been since I began that process before. So finally, after a lot of struggles, I finally found a job that in the insurance covers gastric bypass. So I started the process over again through the same place. I'm going through Hope Bariatrics in Sewickley, Pennsylvania. My surgeon is Dr. Wilcox. He is amazing. He is super nice. So if you're in the Pittsburgh area, I do highly recommend Hope Bariatrics. And I started the process. I had my first bariatric class in November of 2019. And I met with a surgeon in December, and we talked about everything. And I did all of my pre-surgical testing. I had that all done by the middle of January of 2020. So I'm happy to report that I was able to get the authorization from my insurance carrier. So I was able to pick my surgery date, which is 2/24 of 2020. I'm getting super excited because it's coming up pretty soon. I also am starting my 2-week clear liquid pre-op diet on February 10th. So I'll talk to you guys a little more once I start that, because I'm sure that's not going to be easy, as nothing is with this process. But I just basically wanted to introduce myself and talk to you about my journey. And I look forward to sharing the rest of my journey with you. So if you hit the subscribe button below, I will be happy to talk to you and comment with you about the process, my process, your process. If you have any questions, I would be happy to answer them if I can, to my best ability. If not, I could probably find out the answer for you, because I'm going through it myself right now. So I look forward to documenting this entire journey, and I'm super excited. If you have any comments, questions for me, just down below, just ask me a question, and I will gladly get back to anybody as soon as I can. So just hit the subscribe button, and you can join along with me on my, it's going to be a rocky journey, but it's going to be all worth it in the end, because right now, I just really, really need to lose weight, because I'm afraid if I don't, I might actually die because I weigh so much. And there is just no possible way that I could lose that weight on my own without this bariatric surgery tool. And, they do stress that it is a tool. It's not like a cure-all or anything. So do your research before you decide to have the surgery. I know I have, and I've, contemplated every single aspect, and surgery is the way that I have to go. So I hope that you guys, if you're planning on getting the surgery, that you just, do your research and weigh your pros and cons. I did. And, I've decided to go through with it. So I think that's the best option for myself. Just know that it is, like I said before, it's not a cure-all. It's a weight loss tool. And if you follow that tool that they give you, you could really, really change your life around and lose a bunch of weight. But you have to follow the guide. You have to follow the plan. Because if not, then what's the point in going through that life-changing surgery if you're just going to continue your old habits? But yeah, I just wanted to talk to you for a few minutes and introduce myself, to go over the gastric bypass process. First of all, I met with the doctors on November 27th of 2019, and there was a whole class that covered every aspect of the surgery, from phase 1, from pre-op to post-op to maintaining. So they gave us a binder at Hope Bariatrics. I'm not sure if wherever you all are going, if they had a binder and everything mapped out for you, but Hope Bariatrics really, really have everything just so you don't fail. They really, really want you to succeed. So they have the plan mapped out for you to a T. Like, if you follow this, you're golden. You're going to succeed if you follow their plan. They have it written for you. So in this binder, it talks about what foods you should get beforehand to stock your pantry and fridge with. And whenever you meet with the dietitian, she'll go over the stuff that you should be eating, the stuff that you should stay away from, just healthier choices. I understand that it's hard to give up everything right away, but if you gradually just cut some things out, that will make a huge, huge difference. A huge difference. And it talks about everything, multivitamins, the vitamins that you have to take for life. And it talks about the changes you make for life. This is a life-changing surgery. So you have to make the changes for the rest of your life. Because if you do this, if you work so hard at this, you really don't want to fall off the wagon and go back to your old eating habits. Because I know I'm not. This is the heaviest you will ever see me. And in a year, I hope to be half this size, if more than that. So, you see this face, it's going to keep shrinking. And I'm very confident of that. And other things in this binder that they went over with us is every test you have to have prior to getting your surgery scheduled and authorized. You have to have an upper GI, which is basically a test where they look at your stomach. You have to drink this stuff, and it was awful. I'm not going to lie. It was very awful. It's like a chalky, milky consistency, and they look at the inside of your stomach just to make sure there's nothing else going on in there. Like acid reflux. They just don't want to have any surprises come surgery day. That's basically what they told me in there. So they're looking at your stomach. They're looking at the insides just to see, what's going on in there, what they're working with. And the other test was the sleep apnea. You have to have a sleep study to make sure to check to see if you have sleep apnea or if you don't. And I was diagnosed with sleep apnea, so I am on a CPAP machine. And this time around, this is my second time going through the process. I didn't have to have that test done again, which is a blessing because I had it done already before and I am on the CPAP. So you do have to have a sleep study done. You have to meet with a psychologist and they will do a psych evaluation on you. It's basically just to see if you are ready to have surgery and just to see where your mind's at. To see if there's no other psychological issues going on there, which I do have anxiety and depression, but that was diagnosed years ago with my own personal doctor. So I am on anxiety medication. So, the psychologist will determine, if you need to be on something, if you're not on something already, but that's not what they're testing you for. Basically, they just want to see if you're in the right mindset to have surgery, if you understand the risks, the complications that could arise, and to know that basically the surgery is just a tool for losing weight, not a cure-all, because that is not a cure-all in the least. It's just something to help you jumpstart your weight loss. And we also had to meet with a dietitian, and she went over every single thing from you, every single thing that you would need from pre-op, post-op, maintaining. So she told you what you need to do before surgery and after surgery. And it's broken down in phases. Like phase 1, I believe, is a clear liquid diet. And I think you do that like 7 days after surgery. That's how long that lasts. And then you move on to your phase 2, which is your pureed foods. And then from phase 2, I do believe that lasts about 2 weeks. And then you move into phase 3, which is like soft, bland foods. I think that lasts for like 3 weeks. And then you move on to phase 4, which you'll start eating more normal foods. And of course, it's in moderation because your stomach will be super, super small. And they did express that you have to get all of your protein in first and foremost before eating anything else. And you cannot eat and drink at the same time anymore for the rest of your life because your stomach is going to be so small. They don't want you to fill your stomach up with fluid. So 30 minutes before you eat your meals, this will be after surgery, 30 minutes before you eat your meals, stop drinking all liquids. Don't have anything else to drink. And then you eat your meal, protein first. Make sure you get your protein in. If you're still not satisfied, then you can consume a vegetable or a fruit. But you must get all your protein in before you consume a vegetable or a fruit. If you're still not satisfied, I would drink a protein shake. And I forget what I was talking about. Sorry about that. I lost track of my mind there. Sorry about that. And 60 minutes, you can't drink anything until 60 minutes after you've finished eating. So you can you could resume drinking at that point after 60 minutes. But you will be sipping your water instead of you can't chug water because your stomach's so small. You just have to sip just to keep yourself hydrated, but you have to have 64 ounces of water per day. And that's gonna be a struggle because you have to sip it. You can't take a regular drink like any normal person. But I'm up for the challenge. Bring it on. I'll do it. And also, you can't use a straw. They said no more straws for the rest of your life because that does cause air in your stomach and you don't want that. So I am looking forward to sharing my journey with all of you wonderful people. And until next time, I hope you all, if you're deciding to have gastric bypass surgery and I can help you in any way, please don't hesitate to comment to me. I will be more than happy to help you. And if you want to be a surgery buddy, that's awesome. I would definitely love to have a surgery buddy. So until next time, the next time I will talk to you will be when I start my 2-week liquid diet 2 weeks before my surgery. So February 10th, I will let you know. I'll start the process for the liquid diet, and we'll talk then. Have a great day, everybody. Bye-bye.